Good evening. It's a pleasure to be here with you in Perth. This morning started at about 4:45 in Melbourne time. So it's been a long day, and it's been, yes, it's a blessing to be here on this side. And from what I'm told, there is a couple of sides of Australia. Yes, there's the East Coast, there's the South, there's the West, and then there's everything else, where there's a whole bunch of space, but not a lot of people. Is that correct? Is that about the summary? Yeah, this is the best side. All right. All right, that's good. I haven't heard that on the other side, so. Except somebody in Melbourne said something about the most livable city or something like that. I don't know.
Well, never used to be.
Yeah. Yes. All right. Well, my name is Mark Sandoval, and I am a doctor. And so a medical doctor. My background is emergency medicine, actually. And so I trained in California at Loma Linda University Medical School, and then went on to do emergency medicine training. And in emergency medicine, of course, you have to take care of all sorts of stuff that walks through the door or can't walk through the door. Gets pushed through the door or raced through the door or something like that. And in emergency medicine, they say that you're a jack of all trades and a master of one. And that is the emergency airway, making sure somebody can breathe. And but then you need to know pretty much everything from every other component of medicine, because you get to see it all when they come into the emergency department, and then you have to figure out what's going on quite quickly, and then help individuals from that standpoint. And so that was the beginning of my career, again, was emergency medicine. And so then we were taught how to take care of individuals, how to treat them quickly, and then refer them on to somebody else who can take care of them more long-term. And in the emergency department, you have the benefit of seeing somebody once and likely not seeing them again. Whereas if you're in a regular, like, family practice clinic, then you see somebody and then you see them again and then you see them again and you see them again. And so after I started in emergency medicine, I transitioned to a department head, and so I was the head of emergency medicine and family practice at a hospital, which meant that I also had family practice. And since I had family practice now, I also started to have patients that I would see again and again. And seeing them again and again, I realized that my training was a little insufficient in order to help individuals to really be well. I mean, it's one thing when somebody comes in with a laceration and you can suture them up, and that's, it's rewarding, and you get to, see some real results. And so with trauma, there's some really, there's things that you can do in order to help individuals. But when somebody comes in with diabetes and then you put them on medication, and then they come back 6 months later, and then you have to increase the dose of the medication, and then they come back 6 months after that, and you have to add a second medication to it, and then they have high blood pressure and their diabetes, and then you add them, blood pressure medication and so on, and it was just like pill. And it wasn't working, and they weren't getting better, and I went into medicine to help people. I didn't go into medicine just to drug them up, and so that became a bit problematic, and I was not satisfied. Because it didn't seem like I was making a real difference in the lives of individuals. And so began a journey, continued a journey of education, began a journey of education on my own, apart from an educational system. And there are some things that you can really learn when you start learning on your own, outside of just an educational system, and what that has to provide. And I found that there's some very simple things in relation to health. And I was speaking earlier today at another location, and we were talking about trees, and I thought, well, let's talk about trees, right? And what that has to do with health, right? So here you have a tree, and now you have a tree that has some bad fruit and some bad leaves up here. If the tree has some bad fruit and bad leaves, what do you do about it? Well, you can cut it off, right? So you can cut it off. That's something that you can do. Now, in this case, the tree is going to represent people, and the bad fruit and the bad leaves represent symptoms, right? And so symptoms can be things like pain, coughing, itching, sore throat, runny nose, vomiting, diarrhea, all sorts of things, right? There's lots of different symptoms that an individual can have, and symptoms are typically uncomfortable, and, well, honestly, they should be. They should be, right? They're there to let you know that something is wrong. And in the healthcare system, what we typically do for symptoms is to provide a remedy, right? So a medication, some kind of pill. There's a pill for every ill, and oftentimes many pills for every ill. And so you can take 1 pill, 2 pills, 5 pills, 10 pills for the same ill, just until you try to get it under control. And so that's often how we end up treating it. But does it necessarily fix the problem? Not necessarily. So let's imagine that you got back pain, and it's a sharp stabbing back pain just between your shoulder blades. It started suddenly. It's very painful, and it's hard to move. It's you can't lay on your back. And it's really, really uncomfortable, and so you try to take some over-the-counter medication to kind of help out, and no, it's not really helping, and so it's late, and what are you going to do when it's late and you got lots of pain? Well, you go to the emergency department, right? And so you go to the emergency department, but unfortunately, before you went to the emergency department, there was a few buses that collided into each other, lots of casualties. The emergency department is just flooded, and they can't just take care of back pain, And so you're there in the waiting room, and they have somebody that's just assigned to say, okay, what's your deal? Back pain? Here, go, prescription, right? And you can go get it filled. Now, I don't know about around here in the United States. Sometimes you can find pharmacies that are open 24/7. It sounds like around here everything closes like 5. So let's just imagine that you're in the United States and you can get an all-night pharmacy, and so you can get this filled, and so you can take now a real medication along with your partial medication that you got over the counter, and now it kind of takes a little bit of the edge off of the pain, but you still can't lay on your back, and it's still painful, and so you decide that you're going to go to your primary care doctor, and you go to the primary care doctor, and they do something remarkable. They do an exam, and they find out that there's a reason why you have back pain. Right. There's a reason you have back pain. Right. Did the pill take care of the back pain? I mean, did the pill take care of the reason? No, the medication doesn't take care of the reason. Now, you could potentially have enough medication that it takes away the sensation of the pain entirely, but it doesn't actually fix the underlying problem that's there. And that's one of the problems with medication in and of itself, is that it doesn't necessarily fix the problem. It kind of masks the symptoms a bit, right? And symptoms are important because symptoms are like the fire alarm. Now, is a fire alarm a good thing or a bad thing? Yeah, a fire alarm's a good thing. If the fire alarm's going off, is that a good thing or a bad thing? That's a bad thing, right? So the fire alarm is a good thing that lets you know that there's a bad thing that's there. And the bad thing is the fire that's burning up the house. Now, if in response to the fire burning up the house and the fire alarm going off, you want to go back to sleep because this thing's annoying, you get a pillow and you put it over the fire alarm. But you're tired standing there, so you get some duct tape and then you tape it down. Right? And then you go back to bed. Well, if you do that and you burn to death at night, well, whose problem is that? Or whose fault was that? It's yours, because you ignored the signal. There was a signal that was there to let you know something was wrong, but you just did something to ignore the signal, but not actually treat the underlying problem. Right? So that could be a problem. It could be, sometimes. Right? Now, that doesn't mean that it's wrong to treat symptoms. I'm not saying that. Right? I'm not saying that it's wrong to treat symptoms. It can be perfectly fine to treat symptoms, but not to the exclusion of looking for what's going on behind it. Right? Now, if you have bad fruit and bad leaves, yes, you can pluck off the bad fruit and the bad leaves, but that doesn't necessarily fix the problem, because the bad fruit and bad leaves don't grow by themselves. They grow off of the branches, and the branches represent our behaviors. Behaviors, things like breathing, drinking, eating, you know, simple stuff. And, and is it important to breathe? Yes. If you don't, then you'll find out it was important. And drinking and eating, those are very simple things, but those are things that are necessary. And if the branches are not doing well, then the fruit and the leaves that are growing off of the branches are not going to be doing well either, right? And so it's important to have healthy branches too. And if you have bad fruit and bad leaves, it can be helpful to prune the branches so that you decrease the disease burden that's in the tree. Right? And so so now understanding that, I'm doing emergency medicine, now I'm doing family practice. It's just, I realize I'm not really changing individuals, really helping from a foundational standpoint. And so I made a transition, and I transitioned to a lifestyle center. So this is a place where people go, and now they get off of their medication, and you use lifestyle interventions and natural remedies and things of that nature in order to help an individual to overcome their disease and to reverse it and to get off of their medication. And indeed, I now learned, or in that context, I learned how to not just put people on medication, but now how to get people off of their medication and what was necessary in order to be able to do that. Now, it's not that we could get everybody off of their medication, but oftentimes we could decrease medication significantly or get individuals completely off of some of their medications, and some people all of their medications, with significant enough lifestyle interventions. And, looking at wellness principles like, water, drinking lots of water, that's helpful to be hydrated, but not just internally, but there should be external as well. Bathing is helpful. It's helpful. It's a nice thing. Right? And then water can be used from a treatment standpoint in order to help to manipulate circulation and to improve healing and things like that, and that's called hydrotherapy, right? Water therapy. Exercise, that's an important thing, and it doesn't have to be complex, doesn't have to be expensive, it can simply be walking. And that's a lot of the exercise that we did at the Lifestyle Center, was just taking people on walks, and let's go for a walk out in nature, Living temperately, well, temperance means that you avoid what's harmful and you use wisely what's good. That's kind of the basics of temperance, and so it's avoiding those things that tend to be addictive and problematic as far as the system is concerned, and then using wisely those things that are good for you. Love, big topic. Well, we'll get into it later, right? But it's really important. Because a lot of times we think about, water's associated with health, yeah. Exercise, okay, yeah. Avoiding harmful substances, yeah. But oftentimes we don't think in regards to love and how important love might be in regards to an individual's health and their health outcomes. And so that's something else that we were focusing on. Nutrition, of course, and from a lifestyle center standpoint, we were operating on a whole food plant-based diet. No animal products. And in fact, not only was our center operating that way, but I was on the, anyways, over 10 years I got involved in the whole thing, and then I was a board member for other centers and so on, and then we had meetings where we get together and we talk about best practices and other things like that. And I'm not aware of a center that's involved in reversing disease that continues to use animal products as a part of the diet, right? So when you're looking at reversing disease, it's cutting the animal products out of the diet and focusing on a plant-based diet. And then there's environment, which is helpful, which includes things like sunshine and air and being out in nature. Those are things that we oftentimes think of in environment, but it's also including our internal environment. So what's going on in my thoughts? You know, what kind of weeds am I in as far as the thinking is concerned? Is it going to be thought patterns that are going to be helpful or beneficial as far as health is concerned, or are they going to be thought patterns that are going to be detrimental as far as health? And we'll cover that some more later. And then even dress. There are aspects of how we dress that impact then circulation, blood flow, and health overall. And then sufficient rest. So making sure that we get enough rest, that's an important factor as well, and simple trust. Right. So these are some of the factors that we looked at in the Lifestyle Center, and there at the Lifestyle Center, well, man, I learned a lot. Now, there was a dangerous cliff, as they freely confessed, though to walk near the crest was so pleasant. But over its terrible edge there had slipped a duke and many a peasant. So the people said something would have to be done, but their projects did not at all tally. Some said put a fence around the edge of the cliff, some an ambulance down in the valley. But the cry for the ambulance carried the day, for it spread through the neighboring city. A fence may be useful or not, it is true, but each heart became full of pity for those who slipped over the dangerous cliff, and the dwellers in highway and alley gave pounds and gave pence, not to put up a fence, but an ambulance down in the valley. For the cliff is all right if you're careful, they said, and if folks even slip and are dropping, it isn't the slipping that hurts them so much as the shock down below when they're stopping. So day after day, as these mishaps occurred, quick forth would those rescuers sally, to pick up the victims who fell off the cliff with their ambulance down in the valley. Then an old sage remarked, "It's a marvel to me that people give far more attention to repairing results than to stopping the cause, when they'd much better aim at prevention. Let us stop at its source all this mischief," he cried. "Come, neighbors and friends, let us rally. If the cliff we will fence, we might almost dispense with the ambulance down in the valley." Right. That's an old one, Joseph Malins, back in 1895. Right? And it still has so much truth to it. So I began to see things from a different perspective, and to see that, okay, well, an ounce of prevention is really worth a pound of cure. And that it's really important to do things up here in dealing with the issues so that individuals don't end up down there, even though this is where my career began. Right? My career began essentially as the ambulance down in the valley, and now I realize, no, we need to do things up here, and so transitioning to a lifestyle practice and trying to deal with things in an earlier stage. Right? Now, when it comes to the tree, and the fruit and leaves that are the symptoms, and the branches that represent the behaviors, well, the branches don't grow from themselves, they grow from the trunk, and the trunk represents our needs. It's our needs. And what do we need? Well, we need oxygen, we need water, we need food. And in fact, the reason why we breathe is because we need oxygen. And the reason that we drink is because we need water. And the reason that we eat is because we need food. The behaviors are there to supply what we need. Right? And it's appropriate for that to happen. And if the behaviors do not align with the needs, there's going to be problems. If you take in too much, if you take in too little, if you're not taking in the right things, and so on, that will be a problem. And so it's important that the behaviors match the needs, because now you can have healthy fruit and healthy leaves. If not, well, it's not going to work so well. Now, when it comes to the things that we need, everything that we need comes from outside of us, and it must be brought in. But who is it that brings it in? If you need oxygen, who brings the oxygen in? You do. Yeah. And if you need water, who brings the water in? You do. Right? So, if you're thirsty and I have a drink, does that help you? You might be happy for me, but it doesn't help you. Right? I can be here drinking, and you can dehydrate to death if you don't have a drink yourself. Right? So we have our own actions in regards to this. So yes, we need oxygen, but if the oxygen remains right at our nose, even if it's close to us, we will die because we can't live unless it comes in and becomes now a part of us. Right? And you might have water, but if the water stays even close at your lips, well, you're still going to die. The only way that you're going to live is if it comes in and it becomes a part of you. So everything that you need is from outside of you, and it must be brought inside of you in order for you to live by it. Right? So it's important, those behaviors that we have, those actions that we do in order to bring in what we need. So you need oxygen, and the oxygen's not just going to blow into you, you've got to breathe. Right? And you need water, and the water's not just going to squirt down your throat, you need to drink. And you need food, and hopefully the food's not going to just crawl down your throat. Right? You need to eat. Right? And everything first takes what it needs, and then it gives away. And what it gives away blesses or ministers to something else. Right? So, any of you, have you ever kept every bite of food you ever ate? Or when you ate, then you gave something, eventually. Yeah, that's what toilets are for, right? Or latrines, or other things of that nature. Imagine how big we would be if we actually kept every bite of food we ever ate. Oh, I mean, the average human consumes about 6 elephants worth of food during their lifetime. Right? About 6 elephants worth of food. So you would be a pack of pachyderms. Right? You yourself. I mean, how many of us would get through the door by the time we get to this age? And no, we'd be huge. We take and we give. And we take and we give. And we take in air and we give. Right? And we take in liquids and we give liquids, and we take in solids, and we give solids, and so on. But our life comes while we're taking and while we're giving. But if you take it and you don't give it, if you eat but you don't go to the bathroom, you're in trouble. That's a state of dysfunction, and if it continues that way, well, you're going to die. And if you drink and you don't go to the bathroom, well, that's a problem. And if you breathe in, but you don't ever breathe out, well, that's going to be a problem. So there must be the taking in, and there must be the giving away, right? So our needs are supplied by the behaviors, but it's a taking and it's a giving. Right? Now, the trunk doesn't grow from itself. The trunk grows from the roots, right? It grows from the roots. And the roots represent our beliefs. It's not so obvious what an individual believes. You gotta spend time. You gotta dig. You gotta look, right? Or you just have to watch for a long time. Because one thing that will tell you what an individual believes is how they behave. Right? What you believe will eventually manifest itself in how you behave. And so it's important that your beliefs match your needs, because then your behaviors will match what you need, and then you can end up with healthy fruit and healthy leaves. But if your beliefs don't match your needs, well, then your behaviors are not going to match what you need, and then there's going to be problems. For example, if you believe that you need Oh, what do you have? Well, what's all around the world? Coca-Cola. All right, that's everywhere. I've never been anywhere there wasn't Coca-Cola. All right, so if you believe you need Coca-Cola, what are you going to do? Yeah, you're going to drink it, of course. Do you need Coca-Cola? No, you don't. No, you don't. You don't. Thank you very much. If you needed Coca-Cola, no humanity would have lasted long enough for Coca-Cola to develop Coca-Cola. We'd all died off before then if humanity needed Coca-Cola. We don't need it. Now, does it have some stuff in it that we need? Yes. Most of it is water. Yeah, most of it's water. And we need water. So it's got some stuff we need, and it's got sugar. That's not exactly the form of sugar that we need the best, but, you know, if you had Coca-Cola or you had nothing, Coca-Cola is going to keep you alive longer than if you had nothing. But it's got stuff in it that you don't need. And so when you take it, if you believe you need it and you take it, you're going to now provide stuff that you don't need. And when you take in stuff that you don't need, now you're going to have some problems with some bad fruit and bad leaves. And that will develop over time, right? And so it can be problematic. Now, if you have a tree that has bad fruit and bad leaves, what are you going to fix? Well, how many of you fix roots? You ever fixed roots in a plant? I mean, maybe if it's potted and, you know, root bound and whatever, and you pull it out and you rip out the roots so that they're not like in each other and whatever. But besides that, I mean, like if you have a tree that's in the ground, what do you do?
Care for it.
Ah, okay. So how are you going to care for it? Fertilize it. Okay. All right. Are you putting the fertilizer on the trunk and put a little bit on the branches and throwing it on there? No. Where do you throw the fertilizer? On the ground. You throw the fertilizer on the ground, right? So there are sources, right? The soil is the source, right? That's where you get it from. The trees eat soil. So you put the fertilizer and you put the water and all that kind of stuff in the soil because there has to be a source where you're taking what you need from, right? And if the source has too little, well, there can be problems of what you need. You know, if it's really arid and dry and it can't get as much water that it needs to be able to move those nutrients and so on. If it has too much, it just rains and rains and rains and floods and floods and floods. That doesn't happen on this side, does it? That's on the other side. Yeah, okay. Yeah. Here it just burns and burns and burns, right? That's this side? Or is that the other side?
However, we'll probably get somebody this weekend.
Yeah, I don't know. I mean, you're dry over here. It's wetter on the other side, but okay, all right. So you can have too little water, you can have too much water, or you can have the wrong stuff. Like, oh, you mean I'm not supposed to water it with diesel? Oh, well, that's why it's dying, right? So it's important for the source to have exactly what you need. And it's important for you to have the right beliefs so that your behaviors can supply what you need, and then you can have healthy fruit and healthy leaves. Otherwise, it's going to be unhealthy leaves and unhealthy fruit, right? Disease is going to develop, symptoms, and so on. And that fire alarm is going to be going off, and now our usual way of managing it is to take medication, which puts the pillow over the top of it, and then we don't necessarily deal with the fire that's burning in the background. Okay. Now, we need oxygen, we need water, we need food. How many of us need love? How many people need love? Yes. I met two 14-year-old boys. Separate locations, separate occasions. And I asked, anybody here not need love? And it was poof. I don't need it. Yeah, that was a sign of their need for attention, which is a part of love. Okay. Other than that, I've been all around the world, and well, I haven't been to Antarctica. But anyways, I've been to a lot of places, and I haven't met anybody that doesn't need love yet. So you need oxygen, so you breathe. You need water, so you drink. You need food, so you eat. You need love, so you, what do? Right? You need oxygen, you breathe. You need water, you drink. You need food, you eat. You need love, you. What do you do to? What's that?
Love back.
Okay, so you love to, all right, yeah, okay, so you give love to receive love, all right? So I need oxygen, so I exhale. I need water, so I pee. I need food, so I vomit. Is that how we do it? Is that how it works? No, that's not how it works, right? If I need oxygen, I got to take it in. If I need water, I've got to take it in. If I need food, I've got to take it in, right? It's the taking in that satisfies the need, that supplies the need. So what is it that does the taking in for the love? No, it's not giving love. It's not giving love, right? That would be a giving away. But yes, there has to be a taking in, right? All right. So let's say that you were having a really bad day, and the boss demeaned you in front of everybody, and then he fired you, and you get to go home, and you go home, and nobody's happy to see you when you get there, but you stopped at the mail. Do you? Yeah, I don't know how things work here. Anyways, so do you have like one of those things in the door and they put this stuff in, or you have a mailbox somewhere, or you got to go to the post office and it's got something? All right, so you get somehow you get the mail. And in that mail, bill, not bill. Oh, handwritten letter. Oh, and you open it up, leave all the bills till later because you just got fired and who knows how you're going to pay for them. But anyways, so you open up this other letter and it's just from the right person, whoever that is. And it says, dear, and it has your name there, and it says, oh, I've been thinking about you and I can't get you off my mind, and remembering the last time that we were together and looking forward to when we can be together again in the future, and so on. And it's got all sorts of lovey mushy stuff that's in there, and it's signed love, and it has their name after it, and XOXO and so on, and big heart and whatever. How do you feel after you read the letter? Yeah, yes, right? So how much love was in the paper? How much love was in the ink? Oh.
A lot of love.
Okay. So can you take that letter, put it through a processor, extract love chemicals from it, and then draw it up in a syringe, and then shoot somebody with it? And now they're love. All right. So where's the love in that whole thing? Where is it?
Energy.
What's that? Energy. Okay. There is energy for sure. Right? Anytime you have mass, there's going to be energy as well. All right. So, where did the letter come from?
Someone that loves
Oh. All right, somebody that loves you. So it comes from another individual, right? But it didn't come from the paper. What was on the paper is what we would call information. Right? What's on the paper is information. And that information is in a certain way that now I can decode the information because I've been taught that this letter is this, and this, this shape is this letter, and these ones together are this word, and those letters are this word, yes, these words together have this meaning. So now you have a meaning associated with it. And so now you understand it to mean love, and you understand that it comes from not the paper. It doesn't come from the pen. It doesn't come from the hand. It doesn't come from the arm. It doesn't come from the shoulder.
Comes from the heart.
Comes from the mind, right? Comes from the mind of the individual. Or you might say heart, but it's not actually this one. It's this one, right? And so it comes from the mind of the individual. And so you know from that information, it means that that person loves you. And you have now taken the information, you have interpreted it, and now you have believed it. You have believed it, right? So it's a process of thinking. It's a thought process that actually is what brings in the love, right? And there must be information associated with it. Now, do you need a love that is full or incomplete? What's that?
Perfectly full.
Yeah, preferably full, right, yes. Do you need a love that is constant or intermittent? Yeah. Do you need a love that's unselfish or selfish? Oh, sure. Do you need a love that's personal or impersonal? Personal, yes. So we all need a love that's full and constant and unselfish and personal, right? That's what we're looking for, right? All right, now let me back out of the relationship stuff because I can get too far into that. All right, so you need oxygen, you need water, food, warmth, and so on. You don't need suffocation, dehydration, starvation, freezing, burning, and those things, right? Those are not your needs. And you need love, acceptance, respect, honor, truth, mercy, justice, compassion. You do not need selfishness, rejection, disrespect, dishonor, lies, injustice, cruelty, indifference, and so on, right? These are the things you need. You don't need any of those. And so everything you need is good, right? Everything you need is good. It's interesting. And when it's supplied, it allows you to function properly, right? And that's basically what needs are. Needs are the things that must be supplied in order for you to function and for you to function well. And so it's appropriate for us to have food and water and oxygen, but it's also appropriate for us to have love. And when you need oxygen, you breathe. If you need water, you drink. If you need food, you eat. And if you need love, it's a process of thinking. Now, I'm not saying that you just trick yourself into it. It's a processing of information, right? Just like your need for food is a processing of the nutrients in that food so that it becomes a part of you. And so also with love, it's a processing of the mind that makes it a part of you. And you can live by it, right? Now, what if when it comes to sources, what if I believe, what if my roots believe that people are the source of the oxygen that I need? What if you needed another breath and you went to another person to get it from them? That work so well? Yeah, not so much. It's like reverse mouth-to-mouth resuscitation. It's just mouth-to-mouth desuscitation or something, right? And what if you needed water and you went to another person to be your source of water? Is that going to work so well? No, not really. I mean, yes. What if you need food and you go to another person to be your source of food? Yes, yeah, it'll be problematic. It's going to be problematic. Now, yes, anyway, it's the other side of the country that has lived closer to populations that have practiced some things of that nature. Cannibalism and so on, right? And what would happen if you had a population where if you were hungry, you went to a store and you bought a person? And then if you ran out, then you got hungry and you went to the store and you bought another person. And it ran out and you got hungry again and you went to the store and you bought another person. But other people got hungry and they went to the store and they bought a person and so on. Would you eventually be on sale? What would happen to the human population if we all tried to consume each other? Gone. Gone. right? Absolutely gone. Now I know it's really a crazy kind of morbid thought, but it's pointing out something that's important, and that is that no kind can survive from its own kind, right? No kind can survive from its own kind. If every lion went out and ate another lion, well, eventually there would be no lions. And if every lizard went out and ate another lizard, well, then there would be no lizards, right? So nothing ever lives from its own kind. Everything always lives from something else, right? And so, but interestingly enough, we recognize it when it comes to physical things, and we're like, well, that'd be crazy to go and eat people. But we don't recognize it when it comes to love. We might not do cannibalism when it comes to physical things, but when it comes to love, we're cannibals. And it's problematic. It creates problems. It really does. So Michelle was a patient that I took care of at the Lifestyle Center. She came to us and she had stage 3C ovarian cancer, and she had 11 tumors in her abdominal cavity. And she had been an athlete, in fact, an Olympian, and then a coach, and so she was a very fit individual. But later in life, now cancer has come along, and she started having some symptoms, and got things checked out. And by then, I don't remember how many tumors she had when she went and got it checked out. But of course, they recommended chemotherapy, so she went through a round of chemotherapy. And when she did, the tumors were bigger and more in number after that round. Clearly wasn't working. They recommended a second round, and after the second round, she was really knocked down. Hardly walk, of course, all the hair loss and everything associated with it, and the tumors were bigger and more in number than what they were before. And so clearly still not working. And so they suggested that she do a clinical trial where they put together a few chemotherapeutic agents that you don't necessarily usually use for that type of cancer, and let's see if it will do something or not. And she was like, not. No, I'm not going to do that. And so she got online and she looked around and she found our Lifestyle Center. I'm not there anymore, but she was looking it up and she found the website and what we did and so on. And she decided that she would come. And okay, so she came, and I was her doctor. And so I did what I did. We put her on a whole food plant-based diet, and we had her out walking and fresh air and sunshine. And at first she could barely walk much, and so we didn't push her. We just you can go out in the parking lot and do a lap, and come back. And every day it was a little bit more. And we also had some herbs that are known to have some anti-cancer effect as well. And then we boiled her like a boiled egg. It's actually a good thing for cancer. Hyperthermia. Somebody had gone through the literature, the scientific literature, of all of the cases that had been submitted in relation to individuals who had cancer, and then later were documented that they didn't have cancer, so they had remissions. And what were the common factors associated with it? And one of the common factors was a fever. So oftentimes individuals that had a fever, whether they had an infection or they've had a medication reaction with a high temperature, or they had a post-surgical reaction with higher temperatures, that there were a significant number of cases of remissions just associated with fever, or like hot bath or other things of that nature. So with that information, people started picking it up and saying, okay, well, let's use it as a treatment and see how it works. And indeed, it has definite benefits. With the increased temperature, it increases the natural killer cells and cytotoxic T lymphocytes in solid tumors. It disrupts angiogenesis, or the blood vessel growth into the tumor, for up to 96 hours after a treatment. It increases cell death of the cancer cells. It increases the activity of heat shock protein 71, which has an immune function and maybe can help the cancer so it doesn't hide as much anymore, and so on. So we boiled her, we fed her, we exercised her, we did all that kind of stuff. But in the lifestyle center, I had time that I could spend with my patients that I didn't have in clinic or in the hospital. And so I could sit down and I could ask them stories and, what's going on and how, And so I found out that Michelle never knew who her father was. She never met him once, right? And her mother was a party girl, and her mother was, drugs, alcohol, men, and so on. And having a little girl is kind of a problem with your party life because you got to figure out what to do with that thing, and so on. And mom put up with her for about 8 years, but then that was enough, and mom said, all right, enough. And so mom shuttled her off to grandparents. And that was a good move because grandparents were stable. And now she could have kind of a stable environment that she could be with, and so on. And now that Michelle's with grandparents, now she starts calling grandmother mom and grandfather dad, and so she has kind of a parent-child relationship with the grandparents. But mother keeps coming back into the picture every once in a while, and now mother's jealous of the relationship that Michelle has with the grandparents, and now she tries to manipulate and blame and do all this kind of stuff, and it's just chaos, right? Just chaos. And Michelle is not happy at all with mother. Not at all. Right? She doesn't have any problem with dad. She's never met him, but she really does not like mother. And there's a lot of bitterness and resentment that's going on there. And so, I had been learning a little bit about the mind and so on, and I recognized that, okay, resentment, bitterness, that's on the kind of the negative side. and not being resentful and bitter is on the better side, And so it would be better for her not to be resentful and bitter. And so we talked about it and how she could go about resolving that resentment and that bitterness as well so that she could be free from that pressure. And so she took the whole program, she ran with it. Of course, she was an Olympian and a coach, and so she was used to pushing through things, and so she pushed through things, and she did stuff. And by the time the 17 days of the session was over, she could now walk and jog, and then walk, and then jog, and then walk, and then jog for about 3 or 4 kilometers. Right? She was really getting back into it. And her cancer markers, which we measured at the beginning of the session, were elevated, and at the end of the session, they were back down into the normal range. And so, she's excited, right? Excited. 2 months later, she had a repeat CAT scan of her abdomen, and 5 of the 11 tumors remained. So 6 were gone, and the 5 that remained were smaller than what they were before. And we were rejoicing with her that, it's working, The chemo didn't, but this is working. And then 2 months later, which is 4 months out, we get a call. And we're like, what's up? Well, the cancer marker's back up. Oh, okay, what's going on? Are you still eating the food and, the diet? Yes. Are you still boiling yourself? Yes. Are you still taking this? Are you still taking that? Yes. Are you still doing that? Okay. Well, she was still on the plan. What happened? Mother. Mom came back for another visit. And Michelle forgot everything that we talked about, and she was right back into the bitterness and the resentment and so on because of mother. And so I counseled with her again and talked to her about, what we had talked about before and how she could be free from that and so on, and that she needed to love her mother. Right? That's her need, because yes, we need love, but we also need to give love, and she needed to be able to do that. And so when she got back on doing that, then the next call was cancer markers are back in the normal range. Right? So it was the first case in my career where I could see a very clear correlation between what's going on in the mind of an individual and its correlation with what's going on in the body of the individual. Right? And you know, because she kept the rest of the program going, the thing that was changing was her thoughts, right? And so it began to, you know, I began to now look at, okay, the mind, it's really powerful, and we need to pay attention to the mind and what's going on there. And when we talk about the mind, of course, then we have thoughts, and those thoughts are associated with electrical activity. It actually generates the electrical activity, and then that's sent down to kind of the center part of the brain. We might call it the limbic system, and there's the release of neurotransmitters and, you know, chemistry and so on. And then that's received by other neurons and sent back to the cortex of the brain, and now you have a sensation of feelings or emotions. So feelings and emotions actually are a result of chemistry. And I can inject you with something and make you feel differently. Right? I can make you feel a certain way. It doesn't matter what your mental state is at a particular time. I can take adrenaline and I can inject you with adrenaline and I can make you feel anxious. Right? I can't make you be anxious thought-wise, but I can make you feel anxious. Right? But I can't ever inject you with something to make you unselfish, kind, compassionate, thoughtful, respectful, or anything of that nature, right? Because that doesn't reside in chemistry, that resides in the thoughts. And so in the electrical activity in the cortex of the brain, we might have things like reason and judgment and intellect and so on. And then there's the chemical side of things where we have feelings and emotions. And then there in the center part of the brain and in the brainstem are a lot of our automatic reactions that happen in the mind. And the brain, or the central nervous system, is set up in a remarkable way so that every spot in the body has a spot in the brain. So one toe has, you know, one part of one toe has one spot up in the brain, and another part of that same toe has another spot up in the brain, and a different toe has a different spot and a different, you know, and so on. And it's typically so that the head is the same side as the brain and the body is the opposite side. Right? So they kind of switch over. So the right side of the brain will serve the right side of the head and the left side of the body. And then the left brain serves the left head and the right body. Right? So the body is the opposite side as what's going on with the brain. Right? And yes, and there are locations, and everybody, it's the same. Everybody will control their toes from the upper inner portion of the brain, and everybody controls their lips from the outer portion of the brain, and so on. It's all organized and regulated in that way. Right? And so you have those thoughts, they go down to the limbic system, then they can be sent down the spinal cord, and then they go out to the various different parts of the body. And then there are signals that are sent from the various different parts of the body back in the reverse direction so that you can get feedback. So that now, not only are you sending signals, but you're receiving signals so that you can communicate back and forth and control what happens in the body, right? And regulate everything that's happening there. And the beginning of that regulation is information, right? You got to have information that you're working with. And so there's an internalization of information that results in electrical activity in the brain and then going to the various different parts of the body. And it's important what kind of information, because we can categorize information into two different categories. Now, there's different ways that you can categorize it, but in this way, we can categorize it in regards to truth or error, right? Truth or error. And truth, it's interesting because there's a lot of, there's a strong opinion in the world that truth is relative, but in reality, it's actually absolute. Because truth is what puts the right things in the right order, and when truth puts the right things in the right order, it works. And so the outcome of truth is proper function. Right? The outcome of truth is proper function. And so you can test truth by function. If it's the truth, it will result in proper function. If it's not the truth, if it's error, error is going to result in dysfunction because error puts either the wrong things together or in the wrong order or both, right? So it'll be the wrong things in the wrong order. And when that happens, now you're going to end up with dysfunction. That happens. And why? Well, because there is function, and function is always governed by law. Every function is always governed by law. And if it's a different function, it's going to be a different law that governs its function. Of course, we have gravity, and we have thermodynamics, and we have laws of motion, and so on, right? But there's a law that governs every different function. And all laws that govern function are unchangeable, and that's a good thing. Because if we're all sitting here and all of a sudden gravity goes that way, well, yes, it's not going to go so well, right? You know, we will be picking up speed really fast. A few of us are going to be hitting glass and other things like that. And then there's the, you know, and then there's the fence down there. And then who knows where we're going to stop or if we're going to stop, right? No, it is the way that it is, and it remains that way. What would happen if, for example, how much lift you needed in order to get an airplane in the air? What if all of a sudden that quadrupled? And you need 4 times the amount of lift to keep the airplane in the air. But you don't have 4 times the amount of thrust in the engines in order to provide that lift. Well, right? Be a bad thing. So the laws don't change, they stay the same, and that's really good. And proper function is maintained when we remain within the law. Dysfunction comes when we get outside of the law. And there is a fundamental law of all nature, and that fundamental law has 2 components to it, that nothing exists or functions from itself, and nothing exists or functions for itself. And that means that everything is dependent upon some power, some resources, some material in order for it to exist, and for it to function, and if it's a living thing, for it to live as well. But nothing takes in those things and keeps it to itself. Everything passes something along. I mean, even a rock, it's an inanimate object, but the rock can be out there and it takes of the heat from the sun, but when the sun goes down, it starts giving the heat. So that out there in the desert, that poor little lizard doesn't get fried during the day or frozen during the night. Right? And so it might be an inanimate object, but it is taking and it is giving. Right? Everything in nature takes in order to give. And that's really the basis of that law, is that everything in nature takes to give. And from that comes thermodynamics, where all energy is necessary for a system to function comes from outside the system. Right? Nothing produces all of its own energy for it to function by. The energy comes from somewhere else. And then cause and effect comes from this law, where every effect must have a cause, and every cause must produce an effect. Right? And if we look at it a different way, this law of taking to give means that everything in nature functions like a channel. And a channel has an entrance and an exit. The taking is at the entrance, and giving is at the exit. Now, where would you put cause and effect? Cause is at the entrance of the channel, and the effect is at the exit of the channel. Right? Because what comes out is just the effect of what came in, right? What came in. And the channel produces nothing of its own. It takes power, material, resources from somewhere else and then passes it along. I mean, think of a hose, right? Like a water hose. A water hose does not produce water. It's just the channel through which water can go. And it has the water while it's in the process of taking and giving, and ultimately it won't keep any for itself. Right? So the channel produces nothing of its own. It has what it has while it's in the process of taking and giving, and it doesn't keep anything for itself. Those are very basic things in relation to this law, and that everything functions like a channel. Now, let's say that you're looking for a country property. Not Perth. That doesn't look like Perth to me, I don't think, right? You're a little bit flatter here and a little bit browner here, right? But anyways, you're looking for a country property and you find this place, right? Beautiful mountains, you have this nice river that's flowing through it and everything, and it's pure water, and you get to drink it, and you can bathe with it, and you can water the plants with it, and you can put a a generator, in there and make electricity with it, and so, it's great. So if you have a good source, then what you take is good. What you have is good, and what you give is good. Right? So if you've got a good source, then what you take is good, what you have is good, and now what you can give is good. But if you have a bad source, then guess what? What you take is bad, what you have is bad, and what you give is bad. Now, the giving, if what you took is bad, you can't help it. You will give what is bad. You can't. And if you took what's good, you can't help it. You will give what is good. Right? So the giving is just the reflection of the taking, right? Which is dependent upon the source. Right? And so it's important for us to have a good source, like we talked about with the tree and its roots in the soil. Right? So do you need a respect that respects you partially or completely? Completely. Do you need a respect that respects you some of the time or all of the time? All the time. Do you need a respect that respects you so that it can get something from you or give something to you? Yeah, give something to you. Do you need a respect that respects you because it has to or because it wants to? Yeah, it wants to, of course, right? So we all need a respect that respects us completely, constantly, so that because it wants to, and so that it can give something to us. Right? So you only have good needs. You don't have any bad needs. And you're not the source of what you need. And if your needs are only good, and you must have a source that, you must have a source that has what you need, and so you must have a source that is only good, right? It's only good. Do you need understanding that understands you partially or completely? Completely. Some of the time or all of the time? All the time. For itself or for you? Yeah, for you. Because it has to or because it wants to? Yeah, so it needs to be constant, complete, unselfish, voluntary, right? So, can something that needs what you need be the source of what you need? Can something that needs what you need be the source of what you need? Can another human who needs what you need be the source of what you need? Can a tree be the source of what another tree needs? Okay, so we're going to take a tree, and we're going to uproot its roots, and we're going to put its roots in a second tree. And I'm going to uproot that second tree, and I'm going to put its roots in a third tree. And I'm going to uproot that one, and I'm going to put its roots in a fourth tree, and I'm going to keep doing that with all of the trees until all of the trees have their roots in all of the trees. What's going to happen to all of the trees? They're all going to die, right? They're all going to die. Why? Because no tree can be the source for another tree. So it doesn't matter if I take that tree and this one, and then I put its roots back in the first one. If I did that with 2 trees, both trees are going to die. If I do it with 3 trees, all 3 trees are going to die. If I do it with 1,000,000 trees, all 1,000,000 trees are going to die. It doesn't matter how many trees I put into this whole thing. If trees are trying to live off of trees, all trees are going to die. Why? Because all trees have the same needs. So they can't be the source for what the others need. Right? Now what happens if I go to another person and I make them my source, and they try to make me their source. What if we add a third person to it? Or a fourth person? Or 1,000,000 people? And all 1,000,000 people are trying to live off of all 1,000,000 people. Gonna work? It's gonna be a problem. It's gonna be a problem. And it's problematic. So we need a source, yes, and we need a source that's good, yes, for sure. But, I mean, I have a really good wife. I have a really good wife, but she's not good enough. She's okay with that, right? Yeah, okay. I'm not in the doghouse tonight, right? Yeah. But she's not good enough. Because what I need is also what she needs. And if I go to her to get what I need, then what I'm doing is I'm trying to suck her life out so she can supply my life. And if she goes to me to get what she needs, well, I need what she needs. And if she goes to me to get what she needs, then she's going to suck my life out. And so then we're just both trying to suck each other's life out, and it right, becomes problematic. Right. So relationships can become very problematic. Now, I'm just introducing the problem tonight. We're going to go deeper later. So we'll call her Amy. Amy, she had really bad eczema, especially of her hands. And she was, especially like if she did dishes or something like that, her hands got wet and then they kind of dried, then they'd crack and bleed and they're painful, and it was, And Amy, she was not interested in conventional medicine whatsoever, so she didn't want to go to the doctor and she didn't want to take any medication or anything like that, but she was very much into natural remedies and stuff like that. So she was looking up every natural remedy that she could find, and she was looking for the things that would fix it, and she's using all sorts of gels and creams and lotions and stuff and whatever on her hands, and sometimes they were better and other times they weren't, it wasn't so, but it would never it wouldn't go away. And so in talking to Amy, well, of course, if you have somebody that's been doing their own research and they've been trying everything, sometimes it's hard to find out what they haven't done to give them suggestions from that standpoint. But if you can talk to them long enough, you start learning some more stories. And come to find out, Amy was in a situation where she grew up in a family that was very professionally oriented. And her parents had very definite ideas of what success would look like from an education and career standpoint. And Amy had complied with that in her life and so on, and she became very successful in her line of profession. And then she met her husband, and he was a professional as well. And so they were two professionals that were together, and then they had a child, and then they had a second child, and so on. And it's not as easy to keep up with a profession when you have children as well. And then about that time, they had kind of a paradigm shift in their life, and they came across some what should I say? They came across some information that was transformative for them, that changed the direction of the life that they were heading in. And so now they began to see success in a different way, right, than what they had before, and they began to pursue things a different way than what they had before. And Amy's parents were not happy with that at all. Because they thought that she was throwing her life away, and this was, bad decisions and whatnot. And they were trying to put pressure on Amy in order to get her to get back to her right mind and so on. And then they were even threatening to cut her off and not even communicate at all with the grandchildren, and it's all this pressure that's going on. And so Amy's under this pressure. Well, with all of that pressure and all of that kind of stuff, were her parents being the good source that she could take from and then have good and then pass on the good? Or was it a situation where it was kind of like they were the bad source and that's what she's taking from and that's what she gets and then that's what she's giving? Yeah, you know. And her parents are not trying to be a bad source at all. You know, not at all. They're trying to do her good, but just in the way that they see good to be done, right? But it's different than what she wants, and so they're putting her under a lot of pressure, and she's taking that source, and she's under that pressure. And guess what? That's not according to the truth. It's according to error. To take the wrong source. And to then to be able to, and to be put under all that pressure, and to take that pressure as your own. And when her mind was under the influence of that error and that pressure, the mind was putting the body under the pressure. And the eczema, right? And when we counseled and when she started working on things and so on and realizing that she doesn't have to be under that pressure, that she doesn't have to, what should I say? That if her parents or anybody has particular issues, well, that's their issues. But she was taking their issues as her issues, and so she was bearing the burden not only of whatever her own decisions would be, but now she's bearing the burden of her parents' decisions and their choices and so on. And so she's bearing a big burden, and under that big burden, well, now she's having manifestations. Now, she didn't know that was the cause at the time until she resolved the burden. And when she resolved the burden, well, the hands got better, right? And the eczema went away, right? One more story and then we'll finish for tonight. So we'll call him Doug. Doug is a friend of mine. And his wife came to our lifestyle center. And he happened to be there on a day visiting when I was lecturing. And I was lecturing on a particular topic, and he was interested in that topic as well. And so we had a conversation afterwards in relation to it. And then he, let's see, did I have the? Yes, I had the book at that time. Not the smaller one, but the main book, the Law of Life book. Anyways, so I had the book, and I suggested that they get it and they read it. And so he took it home, and 4 months later, it had sat on the shelf, and then he decided, okay, well, I'm going to read it. And so then they started reading the book, and they were like, oh, this is a lot different than what I was thinking of. And they were interested in it, and they read through it, and they thought, oh, this has some really, this has some good stuff in here, and we should share. And they were already doing kind of like they were doing book clubs. And they decided, well, they will use this book to do a book club. And they did, and then they did it again, and then COVID hit, and so then it switched from in-person to virtual, and then they did a third time, and when they did a third time, well, Doug recognized that all right, there was a coworker where he had significant issues with that particular coworker, and those issues apparently had not been resolved because anytime he thought about this coworker, he's got some negative feelings and some negative thoughts and so on in relation to that, and he recognizes, well, that's an issue and it needs to be resolved, right? And so he goes about resolving that particular issue of that resentment towards the coworker, and and talks to them and works things out, makes things right, and so on. Well, I didn't know, he never told me, that he had an autoimmune condition called ulcerative colitis, which is where the colon is attacked by the immune system, and it attacks it at the last part of the colon, then it starts eating up and eating up and eating up and eating up and eating up until it basically eats up all of the colon on the inside, and then you're almost guaranteed to get colon cancer, right? If you have ulcerative colitis and it's not taken care of. And so initially, he tried some stuff, it wasn't working. He tried changing diet, it did a little bit, but then it didn't do much. And then he was on medications and then heavier medications. And it was keeping things somewhat under control, but he wasn't happy with it or the side effects and whatnot. When he resolved the issue with his coworker, the ulcerative colitis went away. and he's off the meds, and he's not been on the meds again, and his ulcerative colitis has been gone, since that time. And, so it's just it's another highlight of another story of an individual where, okay, there's issues going on in the background in the mind of an individual that is where they're under a certain kind of pressure, and that pressure, it's not on purpose, it's never on purpose. It's an unconscious thing. But where that pressure, unconsciously, the mind is going, since it's the controller of the body, is going to put the body under pressure somehow. And now the body manifests that pressure in some dysfunction that happens, right? And yes?
Would you say that would be classic also for Crohn's disease?
Would that be for like Crohn's disease?
Yeah, like,
yes. Yeah.
So a lot of
Yeah.
my family that have that.
Yeah. It's just that the difference between Crohn's disease and ulcerative colitis is just the manifestation. So ulcerative colitis starts in the last part of the colon and works its way up. And it's pretty predictable that it just kind of keeps moving. Ulcerative colitis, Crohn's disease is pretty much anywhere in the digestive tract, and you'll get a patch here, a patch there, a patch there, a patch there. Similar type of symptoms, abdominal pain, discomfort, bleeding, diarrhea, and so on associated with either of those. Both of them are an autoimmune condition. It's just one has a certain pattern and the other one kind of has a different pattern. But yes, they both, yes. And there's a lot of lifestyle things that you can try to do in order to help out with it, and some of them have a benefit associated with them. But if you don't get to the pressures that are going on in the mind behind it, it's really hard to get it under control. But when you do, you see really, really positive things happening, right? So how is it important to your overall health to have the right source? Yeah, a good source, right? And how detrimental is it to have a wrong source? Well, yeah, it's quite detrimental, right? So the question is, what source do you need? Yeah, the right one, a good one, right? You need the right one. You need a good one. You need a source that has what you need, right? That has what you need. All the time, constantly, fully, wants it for you, and isn't there to coerce and manipulate or anything of that nature, right? All right, so that's a little bit about why does modern life make us sick. That's just tonight, right? We've got stuff to talk about tomorrow and the next day and the next day, and so on. That's just, yes. There's a lot to talk about. And I'm still trying to figure out how am I going to pack it into 4 evenings. Because I can talk about this stuff for days on end.
Well, there's also the weekend.
Okay, all right. So there's also the weekend. That's true. I will expand things more over the weekend also. And recover a little bit of this, information as well. What's that? Oh, and we'll have resources tomorrow, yes, as well. All right. You want me to pray? Okay, yes. Then I will pray, and then you may or may not say something at the end. Okay, well, let's pray. Dear Heavenly Father, thank you so much for your blessings. Thank you for your goodness to us. And thank you that you have solutions where we only have problems. And we just ask for you to open our eyes, help us to see what we need to see, and Lord, bring about your solutions, your resolutions, and your healing. And this we pray in Jesus' name. Amen.
And Jacob saw angels ascending and descending from heaven. And he said, surely the Lord is in this place. Surely the presence of the Lord is in this place. I can feel His mighty power and His grace. I can hear the brush of angels' wings. I can see glory on each face. Surely the presence of the Lord is in this place. In the midst of His people, the Lord said He would be. He doesn't take too many. He just takes 2 or 3. And the same sweet spirit I felt times before. Surely I can say I have been with the Lord. The presence of the Lord is in this place. I can feel His mighty power and His grace. I can hear the brush of angels' wings. I can see glory on each face. Surely the presence of the Lord is in this place. There's a holy hush around us as God fills this place. I've touched the hem of His garment. I almost saw His face. My heart is overflowing with the fullness of His love. Surely, without a doubt, I've been with the Lord. Presence of the Lord is in this place. I can feel His mighty power and His grace. I can hear the brush of angels' wings. I can feel glory on each face. Surely the presence of the Lord is in this place. Surely the presence of the Lord is in this place. Praise God.